Hello, my name is Debbie Boone, and I want to welcome you to my podcast, The Bend, where we explore how successful people navigated the path and emerged in a better place when life threw them an unexpected twist. It's inspired by one of my favorite sayings: the bend in the road is not the end of the road unless you fail to make the curve. These conversations will hopefully help you and inspire you to embrace your personal bend and to flourish. I hope you enjoy it, and if you need help with your own personal navigation and you're in veterinary medicine, please feel free to reach out to me at Debbie Boone to Manage Vets Consulting. Enjoy the bend and be inspired by our wonderful guest. Welcome. Well, good morning, everyone, and thank you for joining us today for this episode of The Bend. So today I have a really special guest, somebody that I've been watching her career for a long time, Tasha McNerney. And Tasha is part of the trio that makes up the admin of the Anesthesia Nerds Facebook group and other cool things that they do, where they work to share anesthesia information with other veterinary technicians, well, and I guess and doctors too, who are interested in doing all the things. So Tasha is a certified veterinary technician from Pennsylvania. She works as an educational consultant and a relief anesthesia tech. She's the founder of the Veterinary Anesthesia Nerds, board member of the International Veterinary Academy of Pain Management, and her goal is to educate the public about animal pain awareness. In fact, she was the thought leader behind the now celebrated Animal Pain Awareness Month within the veterinary industry. She became a VTS in anesthesia in 2015, and she loves to lecture on various anesthesia and pain management topics around the globe. She was the 2020 Speaker of the Year at VMX. She's authored tons of articles, textbook chapters, and the really exciting news is that she and her co-authors are now getting ready to launch their newest book, which is called Anesthesia Pain Management for Veterinary Technicians and Nurses. And what she told me is that it is on pre-order now on Amazon and due to ship sometime in March. So thanks for coming on, Tasha. I appreciate it.
Yeah, thanks so much for having me.
Yeah. Well, obviously, I have been a fan for a while, and anytime anybody has an anesthesia question, I just say, go to the Anesthesia Nerds, go ask Tasha. And I think you've made a huge leaps and strides in the knowledge of pain control and anesthesia for not just veterinary technicians, but I think veterinarians too. So tell me a little bit about your origin story and how you got from there to here, and decided to be the pain guru that you are.
Yeah, I will say that it definitely was not, uh, my own thing. Anesthesia Nerds and everything that Anesthesia Nerds now is because of the team of individuals that we have and the community that we built. Yes, it did start by three veterinary technicians and specialists in anesthesia. However, right now, if you look at the demographic of the members of Anesthesia Nerds, and we have almost 80,000 members, but it's a pretty almost, 60-40 split between technicians and clinicians. We have a bunch of anesthesiologists, boarded anesthesiologists on there. We are international. So I'm really proud of the community that we have built to kind of help each other because medicine is a team sport no matter what. Between the clinicians and the technicians and nurses and the assistants and the CSRs and the CVPMs and everybody involved, the patient care isn't just on the clinician, it's everybody. And especially when we look at anesthesia and pain management being such a huge integral component of patient care, we wanted to make sure that we were providing a platform that all members of the veterinary team could come and ask questions, again, no matter how basic or advanced, and feel like they were surrounded by people who wanted to see them succeed. Because we know that when we all grow and learn together, that's going to trickle down into better overall patient care. So we at Anesthesia Nerds really feel like we are making the biggest impact on patient care by giving out the best, most comprehensive anesthesia and pain management advice and education that we can.
I love it. And I really love that you mentioned CSRs because obviously, as the vice president of NAVR, the new Association for Veterinary Receptionists, I appreciate the fact that you recognize that the CSRs have an effect on that pain control because so many times the medical team can promote care and the front office team, if they're not educated, can just undermine the entire message of the doctor by just saying, well, maybe later you don't really need to do it, or most people don't, or, whatever it is, instead of going, yes, this is absolutely necessary and very important to the health of your pet. So thank you for that plug because it truly is a team sport and everybody lays the groundwork at the front desk and then the medical team takes it over. And you know what? They put the period on the end of the sentence at the end
Mhm.
of the visit too. So thank you for that. You went to tech school. Where have you always lived in
Mhm.
Pennsylvania? Is that where you started?
No, I grew up in Miami, Florida. So shout out to Dade County, out down there. I then went to school at Michigan State University. So I am also a Spartan. So yay, go green. And then while I was at Michigan State, I started out as a journalism major and I spent about 2 years just doing journalism. I had to take a bio requirement as just a basic part of the program. And you know what? It just might have been the day. I'm also a very impulsive person, but it just might have been the day, that this bio professor caught me, the anatomy and physiology professor. And she came to me and she said, "You are my top student, and how would you like to be a TA for me next year?"
Oh, wow.
And I was really heavy into journalism. And again, I had just taken biology and A&P because it was a requirement. But I really enjoyed it, and I was really fascinated by physiology and the way these parts work together, and the way, kind of like journalism, the body and through physiology and disease process was telling a story, and I
Hmm.
was really fascinated by that. And after I graduated, I did an externship because I was very convinced that I was going to work with wildlife.
Okay.
So my degree that I ended up, I switched over from journalism to biology, specifically into wildlife biology because I was very interested in like biometrics and wildlife biometry and looking at how do native species and invasive species, cohabitate and, try for resources, etc. So I went back down to my family's house in the Florida Keys and I spent about 6 months working for a wild bird rescue center while I was down there. And it was really down there working through working in the hospital for the Wild Bird Center that I got more interested in, should I be looking at doing something with medicine? And again, because I was really into disease processes and physiology, I thought, well, maybe I'll look at going to veterinary technician school. So after my externship, I'm back in Michigan and I am looking at going back to Michigan State University for vet school. I got waitlisted into the program and I thought, well, I will, work some jobs. We'll figure something out. Wouldn't you know it, that I had an orange cat named Cheddar at the time, and I took him to our local veterinary clinic, and I was encountered by a lovely young woman, and she did the intake on him. She talked me through what was happening. Now, granted, I knew a lot of this anatomy and physiology
Mhm.
already just because of my background, but what I was more interested in was her and her role in this, because up until this time, I had just been told that if you wanted to work with animals in a clinical setting, you became a veterinarian. That is
Yes.
it. There's a veterinarian. You're a veterinarian.
Yeah.
And it wasn't until this moment that I was talking with her and she said, "Yeah, well, I went to Michigan State's veterinary technician program." And I said, wait, the what?"
There's
And
that.
so I was like, that's a thing. And so it was really, she is the one that kind of sparked that me looking further. So I went and looked into Michigan State's veterinary technician program. Um, and just through a twist of fate, again, I'm very impulsive person. sometimes. And so I really want to get out and see the world. I got an offer, hey, why don't you come live in Philadelphia, big city? I've always wanted to live, kind of in a really large city. And I took the opportunity.
That's a little curveball. That's funny that sometimes there's just that little curveball that sets people on a different path, and I completely understand that. I think we're frozen. I don't know. I'm frozen or you're frozen, Tasha. I can't figure out which one it is.
So, and it did all work out. It was great. And I found a veterinary technician school here, and I went to veterinary technician school, graduated from the school here, and then started my career with a small animal clinic. I stayed with that small animal clinic for 13, 14 years total. So it worked out really well for me. It was an exceptional clinic, and I credit, the support I had from the lovely veterinary technicians working within that clinic to really propel me to take kind of the next steps in my career, obtaining a specialty, getting my CVPP, and then becoming more involved just in the industry itself.
Let's talk a little bit about the VTS process because I don't think a lot of people, especially outside of veterinary medicine, know it, but a lot of people, even in the industry that are, working for pharmaceutical companies or, maybe just haven't had the exposure to knowing that they can obtain the VTS, the process behind that.
Yes. So there are many different veterinary technician specialties that can be obtained. Some of them can be obtained simply by working in a general practice. Now, some of them are going to require you working at either university level. VTS process takes anywhere between it takes about 5 years. So if we use the anesthesia one, for instance, it takes about 5 to 6 years to collect the hours in anesthesia that you need to. Yes, I have worked in anesthesia this long. I do nothing but anesthesia, and I feel like I'm ready to apply for the VTS.
Yeah.
So you approved to apply working on and logging your clinical cases. You have to do case logs and then more in-depth case reports. And the in-depth case reports show that A, you understand scientific writing and journal writing, and then also that you can explain, you know, every single process of the anesthetic event in deep detail, and that you can be ready to sit for the exam and be considered a veterinary technician specialist. Again, you could have a veterinary technician specialist in neurology, anesthesia, dentistry, behavior, exotics. There's all kinds of VTS programs out there. There's also a VTS in clinical practice, which is a very nice thing because the really, really cool thing I think about veterinary technician specialists is that there is a lot of chatter within the veterinary industry, and especially for some of these larger hospitals, as to how can we maximize efficiency and how can we ultimately be able to see more patients. There is some talk about, is there room for a mid-level practitioner role? Is there room for, kind of something like a PA within veterinary medicine? But ultimately, we already have it. It's called a veterinary technician specialist. We're just not utilizing them effectively. For instance, if we were truly utilizing, if all of these clinics had a VTS in clinical practice, they could effectively function similarly to a PA in a human healthcare system. And I think that that's probably the next avenue that we should look at as far as technician utilization and career development is more veterinary technician specialists out there in as many practices as possible.
I agree. One of the great frustrations I think I see with technicians who obtain this credential is that oftentimes it's not even recognized as a reason to get a greater salary. And I am shocked at that. I'm shocked that somebody can put all this effort into it. And the same thing goes for CVPM. If you put all this effort, time, and money
Mhm.
in investing in your education, proving that you are an expert, and then to have whoever your employer is go, so, you're not going to do any more than you were doing before. And often it's such an unwise decision to have somebody that talented and invested to have to leave in order to get the recognition that they deserve for going through this great effort. And it is a great effort. You mentioned the mid-level practitioner, and of course, recently, I would hope the audience is aware of the vote in Colorado that allowed for this mid-level practitioner, which kind of horrified me, not because I didn't think that veterinary technicians could do most of this work, and they're doing most of it already. But the surgical component of it really was what put me over the edge. And I have actually interviewed someone who has gone through the master's level program for veterinary technology. And her point was, I don't want to be a practitioner. What I want to do is teach. And all of my specialty training came from VTS in those specialties in the program. So the fact that what she is talking about, I think, is incredibly valuable to the profession, is to have someone who has a master's level training, who's been trained in all the aspects of practice by specialists in that practice, and then they can go out and teach other technicians. Because as you are well aware, there are technicians who graduate from accredited programs who still are not good technicians. The programs are not turning out good practitioners. And there are other programs who are turning out extremely talented people who just have great knowledge. In fact, one of our friends, VTS, Mary Berg, quit teaching at a program she was working with because she was so frustrated that the school was not doing what it was supposed to. Basically, it was taking people's money and not really giving them the education that they were paying for. So I think there's a lot of possibilities for that mid-level practitioner or that master's level practitioner uh, in education.
Hmm.
But as far as doing surgery out in the world, I just say no. Just no
Yeah.
to that.
Yeah.
Yeah.
Potentially, I will say that I may disagree only slightly on one thing, and that's that I do think that, and again, I have not looked through all of the components of, the master's level
Mhm.
at some of these, and I am 100% all for more education. I mean, it's kind of like our whole vibe at Anesthesia
Mhm.
Nerds is more education, the better. But I think that we are maybe doing a disservice is that for some of these, you may be able to have a master's in veterinary technology. And I don't always think that that will equate to you being a good educator. And because I know a lot of CVTs that also have a master's in education. When we dive into adult learning theory, and especially when we put in the technological aspect of the new ways of learning, I think that that's something that if we're thinking that master's level is going to go into education,
Mhm.
then we may have to look at, well, there's already a program called the Masters of Education, and how will our Masters in Veterinary Technology blend together some of those theories that if we are putting people in educational positions or they're directors of programs, et cetera, how are they combining the veterinary knowledge and the technical skill with the learning theory and learning development?
Mhm. Yeah, yeah, very interesting. And I wonder if that master's level program actually has that component of adult learning. And because it is, we learn. I'm kind of a neuroscience geek, and so we learn how the brain works and what makes things stick. And I can tell you, growing up in the 50s, 60s, and 70s going to school, that the way we learn now is definitely different than the way we were said and taught to, basically regurgitate out of a book and take a test and get a passing grade. So very, very interesting conversation, Tasha. We could take it a lot of ways. But I do want to talk to you because obviously you guys help empower veterinary technicians by giving them so much knowledge and truthfully a place to go to learn it appropriately. I'm excited that you have so many people in that group that are learning about anesthesia and really pain control. Because again, I've been doing this 40 years and starting out as a part-time receptionist and then a hospital administrator, pain control was not on our radar. And it was actually considered probably a good thing to keep them in a little pain because they wouldn't move around, right? They just would stay
Hmm.
still and wouldn't pull their sutures out. But then knowledge changes and we learn new things. And so constantly learning new information about pain control and how to take care of pets better. certainly I've watched that progress a lot over my career in vet med. So tell me a little bit about how did you kind of get focused in anesthesia and how do you get your knowledge? Because you and Stephen and Darcy are really putting a lot of information out there to the world. How do you uh, learn and do you do research? Are you involved in those kind of studies?
Yeah, so great question. Multitude of layers of answers there. I definitely have always, again, been very interested in physiology. I think it's very interesting how, a neurotransmitter functions or how the different, pain receptors function and how certain drugs can lock into these receptors. And it really is, it's fascinating. Like drug receptor physiology is amazing. I was lucky enough, like I said, to get into a clinic that really supported technicians. And I will say that I think that this clinic that I worked at right off the bat was so successful because they were a very technician driven clinic. And what I mean by that is that certainly the clinicians they would be responsible for their diagnosis, prognosis, surgerize, and prescribe. But if it was not directly those four things, it was the technician's responsibility, which means that for um, a lot of the patient care, a lot of the client communication, a lot of the note taking, documentation, etc., was performed by technicians. Everything was very technician driven. And I just happened to be put on a surgery rotation with a wonderful, wonderful technician who became my mentor and still to this day, a very good friend. Was literally texting with her this morning by the name of Vicky Byard. And Vicky Byard is a CVT and she's also a VTS in dentistry.
Dentistry. I know
And
her for many years. Yeah.
she was one of the ones that really helped create the VTS in dentistry. And she was one of the founding members, which she was passionate about technicians kind of taking their career to that next level and being more involved. And she is the one who really pushed me forward into, looking more into anesthesia. And that's because she's doing dentistry. She needs somebody to do anesthesia. I just happened to be put on a rotation where I was the one responsible for doing the dentistry anesthesia. And I worked very closely with her for years and years and years. And she was the one who kind of pushed me to look into getting my specialty in anesthesia. She was the one who introduced me to another, like, again, great mentor of mine by the name of Nancy Shaffron, who is not only was a VTS in ECC, but also she was very highly involved with the International Veterinary Academy of Pain Management. Nancy is the one who pushed me to get my certification as a veterinary pain practitioner. So between the two of them, I had really fantastic mentors kind of, pushing me to keep going and make a bigger impact in the profession as much as possible.
Yeah, I love that. Nancy asked me one day to teach a class on dentistry, and I went, Nancy, to technicians. And I said, Nancy, I've never cleaned teeth in my life. I said, I can sell it. That's the thing I know how to. That's what I want you to teach. I want you
Mhm.
to teach the process of getting the clients to say yes. I went, oh, that I can do. But it was a little intimidating. And Vicky was in the audience when I was teaching this class, and it was in New Jersey at ACVC. So yeah, it's veterinary medicine is such a small world, and if you've been in it a long time, you pretty much will connect with most of the major players out there that are the change agents for sure. And so,
Yes.
but yeah, Vicky, I met a long, long time ago, and was so interested to find out, her career path and what work she had done with dentistry. And in fact, I think I might have met her through. I was working on the Greenies Oral Health Advisory Council,
Mm,
and that's how I met Mary Berg. It's definitely that way, but and a lot of other good friends like Jan Bellows and and Brittany, the dental gurus from East Coast to
yes.
West Coast. Yes. Yeah. So, um, tell me now, I mean, you're working in practice still,
Mhm.
and do you feel like your work is just progressing and that you're finding out like more and more stuff all the time? Is this, how has pain control changed, gosh, just in the past 5 years?
Oh, huge. Every day I think that we are getting closer and closer to being, as efficient as we can be with analgesia. And I want to know every time a cat comes in, what's the drug I should use? And the thing that I love about anesthesia is that it is not black and white like that. There is no one drug, there is no one protocol. Everything is so many shades of gray, depending on the patient in front of you, what procedure you're about to do, their ASA status, etc. There's so many variables when it comes to creating an anesthesia and pain management plan specifically for a patient. And we have had so many advances as far as pain recognition within veterinary medicine that now, I mean, that's one of the things that we were really proud with this newest edition of our textbook is that not only are we looking at pain management from a physiological standpoint, but we're also starting to understand that pain management has an emotional component as well. We've known this in human medicine. We know that fear, anxiety, and stress can increase the overall pain response. And another thing that we've gotten even better at through research, and especially shout out to the folks in Montreal doing some of this really impactful research, is how to recognize pain. There's a bunch of different pain scoring options out there that we can look at. But now we have an app on our phone. So the feline grimace scale, you can have an app on your phone and you can be able to in real time score feline acute pain, which is going to help us make better overall post-operative analgesic decisions for cats. So I think there have been a lot of advances in pain control. They're just continuously moving the needle forward and making it better for our patients.
Yeah, I love that feline grimace scale. And if anybody hasn't seen it, there's certainly paper versions of it out there. You could just certainly just Google it. But it
Hmm.
really is, for people who are not particularly aware, they're subtle. Some of the signs are subtle. You wouldn't pay attention to, especially when they're not, acute. You just see that discomfort where it starts with discomfort and then ramps up. And I love that. I just think, of course, I sit on the Fear Free Advisory Council, and I have since the doors opened. So I am really aware of fear, anxiety, and stress, and the fact that pain causes all those things to ramp up. And
Hmm.
the one of the things I've always said in human health, and especially with technician health, is that if we need to have physical health guidelines for our veterinary technicians and our veterinary teams, because if you are in pain, mentally, you are suffering. And it's hard to be kind and nice when you're in chronic
Hmm.
pain. And the work that you do is very, very physical. And sometimes, people do not use the best choices of lifting. They love to like, I can do it, let me get the 50-pound
Hmm.
dog, I'll do it myself. But that takes a toll on your body. And after a while, you can't physically stand to do that stuff anymore. So I feel like all this could play hand in hand. And it's just like with fear free, if we understand fear, anxiety, and stress response in animals, all it takes is just a slight movement over to understand it in humans because
Hmm.
it's exactly the same limbic brain responses. We're just animals at the top of the food chain. And this is, it translates so easily. So I love that. Um, Tell me a little bit about what you consider your biggest career mistake to be.
This is a hard one because I love my time that I spent at the clinic that I worked at for, close to 13, 14 years. But I think really looking at it because this is a career that I want to do for my entire life. I don't see leaving veterinary medicine. I love veterinary medicine, but I think that probably my biggest career mistake was not changing clinics often enough. And that is twofold. A, because it gave me, especially because I stayed at my very first clinic for almost 14 years, it gave me a really narrow view of what I thought the right way to practice medicine is, or this is the good way to practice medicine. And now, right, now that I've been in so many consulting practices, now that I've gone internationally and seen clinics, from Australia to Russia, now that I've seen all of these different ways, it kind of gave me a bigger scope of here's really what a spectrum of care looks like. And I think that's really important. So, not only from a spectrum of care standpoint and knowing that and what I could do and what I could offer to my patients, but also quite frankly, from a financial standpoint, there's a lot of data to show that jumping around clinics or, jumping around jobs every couple of years, especially as a woman in this field, you're going to make overall more money. So, while I do think that at first there was this idea that if we jumped around clinics or you have a lot of stuff on your resume or every 2 years or 3 years you move around, that's going to be negative on your resume. That's not the case anymore. That's
Mhm.
not the case anymore. And not only are you going to get a diversity of thought and experience, but also statistically, in the long run, in retirement, you're going to end up with a bigger financial reward.
Yes, yes, yes. I'm so with you on that because when I first started working in hospitals, I was there for 19 years in my first practice. Now, I started off as a part-time receptionist, working in one of the satellite hospital in what I call the mothership. And then after 6 months, I left and I started managing a fabric shop. And I left there and I managed a jewelry department of a big box retailer. And then I sold one of my veterinarians a watch. And that's how I got my job as the manager because my boss called and said, my wife tells me I need a manager. But I stayed in that practice for all those years, and it was an AHA accredited practice. It was very bells and whistles. We did not have a single licensed technician, unfortunately, because I couldn't find them. We were in a desert. So they were all homegrown. And my doctors did a lot of what I would call technician work looking at it today. But leaving there and then going to work at another hospital, it was extremely eye-opening. I mean, just the difference in practicing medicine, different techniques that were used. And we hired mostly new grads in our first practice, so they just learned to do it the way our doctors were doing it. So there was not a lot of, I mean, they brought new stuff in, but still it was fairly stable how we did stuff. But now as a consultant going out into the world, there are certainly a lot of different aspects of practice and the way things people do things. Now, some things I will tell you as a consultant and going in, and I'm sure you've seen the same thing. I am horrified at some of the things I have seen.
Oh,
Um,
yeah.
but then other ones I'm looking at quite in amazement, going, that is really great. I mean, the outcomes are really great. So we can all learn from each other and raise the bar. And I love that you mentioned spectrum of care because, again, as someone going back 40 years, there were ways that my doctors figured out how to help, and they weren't gold standard university level stuff, but they worked. And I feel
Mhm.
like there's where we are is we've trained a whole generation of veterinarians that they're going to get sued if they don't practice it the way they came out of school with it. But the truth of the matter is you need to work with the client. You need to figure out how you can best help, and it doesn't always have to cost a fortune to do it, because there are ways. And so I love working with folks like Dr. Kate Boatwright and figuring out that spectrum of care work because, yeah, it doesn't always have to be everything in the kitchen sink. Sometimes you can just, if you're a good clinician, you can figure it out.
Oh, yeah. And especially, anesthetically and from an anesthetic and analgesic standpoint, certainly there's a lot of variability
Mhm.
in, kind of what is being offered out there. And you're right, there are some things that normally I'd be like, oh, that does not look really safe or great for the patient.
Mhm.
However, I really try to go forward with the thought that everybody really is doing the best with what they got, and everybody's best looks different day to day.
Mhm.
And also, most people in this field are practicing with good intent. I
Mhm.
don't believe that there are a ton of people in veterinary medicine choosing, to certain procedures or use certain drugs because they've known or it's what they have available.
Mhm.
And I think that if I approached everybody, judging them for not using a fentanyl CRI and whatever, a
Mhm.
fancy mechanical ventilator, then I would be doing a disservice to a lot.
Mhm.
And, you know, just a couple of weeks ago, I was texting back and forth with a clinician who is legit in the fields in Nigeria having to do a dog leg amputation.
Oh, wow.
So, you know, it would be short-sighted of me to say like, well, you really should be doing an ultrasound guided nerve block and utilize they don't even have a vaporizer. Do you
Right.
know what I mean? Like
Yes.
they're
Yes.
they are doing the best they can with the limited things they have.
Mhm.
And what I always try to tell people is it doesn't matter if you're at a university or if you're at a GP clinic in Jackson, Michigan, you can do amazing anesthesia and pain management with what you already have on your shelves. Let me help you get there.
I love it. I love it. So let's talk a little bit about the book and how you compile that and what people can expect to find in it.
Yeah. So our book is a second edition, but I will say that we kind of did a big overhaul, almost a complete overhaul. And that's just because it was about 8 years since the between the first and the second edition, and so much research has come out. Again, not only from a pain scoring standpoint, but also drugs and therapies that are available, also adjunctive therapies that are available. We have a whole chapter that goes over integrative medicine and adjunctive therapies, because from a pain management standpoint, we know that yes, drugs and pharmacology are important. However, there are a whole bunch of different ways that we can manage pain and manage those signals going into the central nervous system that do not involve drugs directly. How can we provide the non-pharmacological pain management? How can we provide pharmacological pain management? And when we do provide pharmacological pain management, are we making the best choices with the drugs that we have on the shelf and available to us? And something I'm also proud of is that we have a huge chapter on local blocks. And for me, the thing that I really love about this edition of the textbook is that not only does it have the traditional things like, analgesics and pharmacology, but we also have chapters on non-pharmacological options because we know that pain management isn't just about throwing drugs at a patient. We know that there are other things. So physical therapy, things like low-level laser therapy, things like acupuncture, massage therapy, a comprehensive pain management plan. We also have a whole section on pain management and anesthesia career options that you could look at as a veterinary technician and nurse, all of the different certifications that are out there. And we give resources in our book chapter. And then one of the things that I am most proud of is that we have a huge expanded chapter on local and regional anesthesia and local blocks, which is amazing as far as if we talk about, reducing opioids in our patients, what is one way we can do that and provide additional comfort? It's utilizing local blocks as often as possible. So that chapter has been expanded. And again, it's a very, very good resource for anyone working in anesthesia or pain management.
That's wonderful. That's wonderful. Um, so looking at this long lens of veterinary medicine that you have, what advice would you give someone who is looking to, expand their career opportunities in vet med, other than you already talked about, it's okay to change jobs. And, I
Mhm.
agree with that. As someone who hired in veterinary medicine, like you, at first I looked like, why are they job hopping all the time? But it never bothered me when there was always advancement or always
Mhm.
more money. And so this makes sense that they're advancing their career and moving jobs. And, I look at it like this. It's very hard to move up in vet med because there's limited roles in the hospital unless you are in a monstrous hospital that has, tons of employees and hierarchy. So moving up within the practice, moving out if necessary, but what advice would you give to someone about just taking the chance?
Well, I will always say to take the chance. I think that a lot of us, deep down in your gut, if you get an offer to do something and you're like, yeah, that sounds amazing. But no, if your initial instinct is, yeah, that sounds amazing, go for it.
Yes, leave the
Go
book
for it, man.
out. Yeah.
Like just go for it. And again, There are so many different avenues within veterinary medicine. Now, yes, certainly if you worked at like the University of Pennsylvania, there's all different departments and there's, management and et cetera. But even within a small clinic, even if you were a clinic of 5 staff members total, and I think this really begins with leadership. I think the practice managers and the leaders of the clinics need to be continuously developing their staff and continuously meeting with their staff. So that means this is not a once a year performance review. This is a continuous, how is it going? What are the aspects of this job that really light you up? What are the things that you love doing? You know what? Nobody really loves, writing discharge instructions or some of the more tedious things, right? Counting inventory. However, there are going to be a lot of people who say, you know what, I really love connecting with the clients and I love that. Great. Can we work on getting them some more training in being, a client liaison or the person who, at our practice, we have a specific role that is called a patient care advocate, and they handle the majority of the phone calls and the text message and do direct communication with the clients on the status. So that way, the clinician doesn't always have to be the one doing it because, again, the clinician should be doing what? The diagnosing, prognosing, surgerizing, and prescribing. Other than that, we need to be training our technicians and assistants and nurses to be doing these things,
Mhm.
right? So I think it's really up to management to sit down and develop their staff. So I get a little bit frustrated when sometimes people will say, well, there's really not a room for advancement at my clinic. If there's not room for advancement at your clinic, then I'm sorry, you're not at the right clinic.
Mhm.
Any clinic, again, whether it's 500 employees or 5 employees, I do think that good leadership and management will always be looking for ways to educate and develop and grow their employees. And
Mhm.
yes, sometimes that means that they might grow beyond the confines of the clinic itself. But doesn't it contribute to the greater good of veterinary medicine as a whole if they outgrow our clinic and now are moving on to the next thing and again making a bigger impact in overall patient care? So I feel like, that's the way kind of Vicky Byard always trained me, and that's kind of the mindset that I take into when I'm, giving advice to newer technicians as
Mhm.
well.
Yeah. Yeah, I think a lot of times managers, and I've had people say this, well, if I train them, they'll just quit and go somewhere else. And I went, if you don't train them, then you're
Hmm.
subjecting your patients and your clients to untrained people. And that's really not the way to practice or run a business. So why would you do that? But yeah, I'm like you. I'm personally am kind of a geek and I love learning about anything and everything. And so I would bring people in to train my entire staff. The front staff got medical training just like the technician staff because why? They were talking to the clients every day, all day long. And they needed to know those things so that they could support the medicine. But then in the same aspect, my entire medical team got DISC personality profile training, and they also got fish philosophy training and all the other parts of running a business. And we even had financial advisors come in and talk to people because you know what? Sometimes we actually do make sufficient living wage. We just don't know how to manage our money. And so let's make sure we're managing our money appropriately. Um, so always educate. And so if somebody educated themselves out of my hospital, that's great. One of the most things I am most proud of is that some of the kids that I hired as high school kennel attendants went on to become veterinarians, and some of my associate veterinarians went on to own practices. And so there are 9 practice owners that came out of my practice when I was managing there. And I don't, that's the ones I know about. There may be other ones I don't even know, and a couple of doctors, human physicians. And so, it's better to have a wonderful person for 1 year than somebody horrible for 10.
Mm, yes, 100%. Yes.
All right, let's ask if you got a fun fact about you. Do you have a secret talent? Do you have a interesting hobby?
No, no, I don't. I'll tell you, I wish that I did. I don't play any musical instruments. I don't play any sports. I will tell you, if this will be a piece of advice. Kids, don't do what I did. I pretty much made my entire life veterinary medicine, and it still is veterinary medicine to this day. And I am slowly just now you turn 40 and then I'm like, wait a minute. All I do is veterinary medicine, and my weekends are creating other things related to veterinary medicine. So this is really, in all honesty, you know, my 40s are the first time that I have thought, oh, wait a minute, maybe I could do something else that doesn't relate to veterinary medicine. And it's the first time that I'm like, well, I'm gonna get involved with, the community. So now I'm involved in a community art project here in our local town. And I wish that I had some kind of like fun, cool, like, oh, I'm also a violinist. No, I haven't. I've spent 20 some years just doing anesthesia and pain management in veterinary medicine, and I am so pigeonholed. I'm just now breaking out.
So there is words of wisdom. Find something else to do. Yeah, I've said to my audience many times, find something else to do that is not veterinary medicine related. You need the mental break.
Hmm.
And it will refresh you to come back into it with a fresh set of eyes and look at it a little bit differently. Over the years, I've taken art lessons. Of course, I'm much older than you are. Taken art lessons. That was what I did when I turned 40. I decided for the first time I was going to learn how to paint. And I started painting pet portraits, which was a lot of fun for me. Again, going back to us,
Hmm.
always animals, right? It was always animals, even in art. And now I am kind of an obsessive gardener. My husband is like, "Do you really need all these raised beds?" And I'm like, "Yes, I do."
Hmm.
And so he's got to build me some more flower beds. But it gets me outside. It gets me
Hmm.
away from the computer and building content and thinking about vet med because I'm just outside digging around in the dirt, and that's always a good thing. So I think learning to not be so laser focused, even though, like you, for me, it's fun. It's fun. I
Yeah, it
just
is
love
fun.
it.
It is not, I mean, certainly there are days,
Yeah.
everybody has a day at the clinic that you're like, wow, what am I doing?
Yes.
I could be working in a field that I don't get peed on every day, and maybe making more money. But ultimately, I love veterinary medicine. I love the people that I have met through veterinary medicine. I love, talking to newer technicians as their light bulb goes off and they discover that they also love anesthesia and pain management. That's an amazing thing to be a part of. But yeah, I also have been like, wait a minute. When I'm not in the clinic, I'm working on the Veterinary Anesthesia Nerds podcast, or I'm writing a textbook, or I'm designing Veterinary Anesthesia Nerds merchandise. I feel like maybe I need to do something that doesn't have to do with veterinary anesthesia.
Exactly. Exactly. Well, I will tell you that we appreciate your obsession with veterinary anesthesia because it has done a great deal to help veterinarians and veterinary technicians take much better care of their patients. And the patients certainly appreciate it. Tucker went yesterday to have his teeth cleaned, and so I'm certain that somewhere along the line, his surgical technician benefited from the knowledge that the anesthesia nerds put out there into the world because he is doing very well, although he is always clingy and wants to sit in my lap. Thinks he has to be on the show. Well, Tasha, thank you so much again. And I'm sure that the audience looks forward to your book coming out. I'll put the link in the show notes so that they will have that. And I appreciate your time today and keep doing what you're doing, but enjoy your community work out there in the world. And
Thank you
maybe
so much for having me.
you're quite welcome. You're quite welcome. And thank you to the audience for joining us again today for this session of The Bend.